everyone, and welcome to today's webinar, brought to you by LGC AXIO Proficiency Testing. It is my great pleasure to welcome all of you who are joining us today, where we will be exploring the Salmonella story, the past, present, and future of PT in Salmonella testing. The subject of Salmonella is an ever-prevalent topic of conversation, which continues to evolve, and one we are excited to explore with you today. So thank you for joining, and we hope that you find today's webinar informative and valuable to your work and your knowledge base. So just a short introduction from myself. I'm your host for today, and my name is Brooke Dawson, and I'm the Global Assistant Brand Manager here at LGC AXIO Proficiency Testing. More importantly though, I'm delighted to be joined by two of our very own AXIO experts that I will introduce in just one moment.
I'll come down and see you.
So, what is this webinar about? This session is designed to reflect on how the role of laboratories responsible for the detection of Salmonella has evolved over the years, and to explore not only key learnings and insights that AXIO has gained in its experience, but also to understand the role that proficiency testing has played in keeping consumers and brands safe. Today, we will reflect not only on the background and importance of PT for Salmonella, but the history of that testing and how we have evolved to meet the demands of the world. We will take a look at the latest from the AXIO laboratory, as well as exploring what an analytical laboratory could expect in the future. This is definitely not a session to be missed, so I am excited to move on and introduce our key speakers. Today we are joined by Valerie Bardin, who is the Global Product Manager for LGC AXIO Proficiency Testing. She is responsible for keeping up with the latest trends and new developments of our product portfolio to meet ever-changing demands presented to laboratories. We are also joined by Tracey Noblett, Head of Microbiology for AXIO. Tracey is responsible for sample design, manufacture, and the running of the microbiology schemes from the LGC Berry site. There should be some opportunity at the end for some questions. So if you do have a question for Tracey or Valerie, please write it in the chat function in GoToWebinar, and we will try to tackle as many as we can at the end. So I think that's enough for me for the time being. So I'm going to hand over to Tracey to start our presentation entitled The Salmonella Story, the Past, Present and Future of PT in Salmonella Testing. Tracey?
Thank you for the introduction, and I'd also like to say thank you to every one of you for choosing to give up some of your precious time to join with us today. As Brooke said, I'm responsible for the microbiology PT schemes at LGC, and I've been working in the field of microbiology for almost 40 years now, and in proficiency testing for 25 years. So for those of you thinking I don't look old enough in the photograph that was on the previous slide, I must point out it's a very old photograph. Unfortunately, I've aged a lot since then. So to talk through more information about the background and importance of Salmonella throughout history. So although I'm a microbiologist, I'm also very interested in history, especially history involving microorganisms. So I was very pleased to find a reference to Salmonella going back to ancient Greece. In between 430 and 424 BC, there was an unidentified plague that spread through Athens in Greece, and it killed around 1/3 of the population, including the leader at the time, Pericles. It has been speculated that the plague was caused by typhoid fever, which is caused by the Salmonella typhi. People have actually recovered DNA from remains from the time that showed the presence of this bacteria. However, there have been lots of arguments, as the clinical symptoms didn't exactly typify Salmonella typhi, so it may be that Salmonella typhi and another organism were present at the time. Even before the discovery of Salmonella, scientists believed that typhoid fever was spread by contaminated food or water, although it was not known whether the contaminant was a microorganism or a toxin. So a great number of scientists and doctors spent their time working on trying to identify the cause of the disease for many years with no success. It is believed that finally Salmonella was isolated for the first time in 1879 by a doctor, Carl Eberth, who discovered a bacillus in the lymph nodes and spleens of typhoid patients, and he published his observations in 1880. His discovery was then verified by important English and German bacteriologists at the time, including Robert Koch. The genus was later given the name Salmonella in 1900. This was in honor of Daniel Elmer Salmon, who was an American veterinary pathologist. It was actually his assistant that did most of the work, Theobald Smith, and he isolated and named the first strain of Salmonella, hog cholera bacillus, as it was thought to be the causative agent of hog cholera. So what's the definition of Salmonella? There are many different definitions for organisms, but they tend to be defined by their cell shape, their gram reaction, morphology on agar, and biochemical reactions. So definitions of Salmonella commonly include the following factors. It's a member of the family Enterobacteriaceae, along with other species such as Klebsiella, Enterobacter, and Citrobacter. Salmonella are gram-negative, non-sporing rods, and they're facultatively anaerobic. So that means they can switch between using oxygen, but also fermenting if oxygen is absent. The organism is oxidase negative and usually motile, except a few cerevars that are usually found in poultry. When grown on agar, Salmonella colonies are generally 2 to 4 millimeters in diameter, and they mostly produce hydrogen sulfide on appropriate media. If you look at the standard AXIO 6573, they have a typically sort of vague definition that says Salmonella is a microorganism which forms typical or less typical colonies on solid selective media and which displays the characteristics described when confirmation tests are carried out. And in the pictures on the slide here, you can see microscopy of a Salmonella cell, showing it with a rod shape and several peritricious flagella. The bottom left picture shows Salmonella colonies on XLD agar, producing typical red colonies with black centres. This is due to the production of hydrogen sulfide. Any Salmonella that do not produce hydrogen sulfide appear as red colonies on this agar, so can be difficult to detect. The picture on the bottom right shows MSRV agar. This is a semi-solid agar that allows the organisms to swim through the agar, and it produces these opaque halo effects. So it's an easy test for motility, to show motility of the organism. So taxonomy, onto taxonomy, which is everybody's nightmare, I think. The taxonomy of Salmonella can be quite confusing, especially as it's changed many times over the years. Techniques get more sophisticated, and strains can be differentiated from each other by different factors. So this table is my attempt to give a simple summary of the current taxonomy of Salmonella. In short, there are two species, Salmonella bongeri and Salmonella enterica. These are divided into 7 subspecies, which are then further divided into around 2,600 cerevars. These cerevars are all based on possession of different antigens. There are O antigens or somatic, bi antigens or capsular, and H antigens or flagella. All of the cerevars are grouped according to their O antigens, and the groups were originally named alphabetically from A to Z, but then the letters ran out and numbers started to be used. And all these cerevars are defined in a publication called the Kaufman-White scheme. So the vast majority of cerevars fall into the Salmonella enterica subspecies, and this subspecies also accounts for 99% of Salmonella infections in humans. Many cerevars are named after geographic locations. So the examples there, Salmonella Singapore, Salmonella Stuttgart, Salmonella Montevideo. And closer to home for me, there's also a Salmonella Manchester and a Salmonella Salford, which are both cities quite near to me. So wherever you are in the world, there was probably a Salmonella discovered quite nearby. So where is Salmonella found? In this case, it would be easier to produce a slide that says where is Salmonella not found. Salmonella is prevalent almost everywhere, and this is because it can live in many hosts asymptomatically and then be easily spread by fecal and oral contamination throughout the environment that we all share. Poultry is one of the most commonly implicated animals, although reptiles, such as the friendly bearded dragon pictured here, have also been implicated in outbreaks. And this led to the CDC the Centre for Disease Control and Prevention, recommending that bearded dragon owners wash their hands after handling their pet, and also not to kiss or snuggle bearded dragons, just in case they were tempted. Many people can also be asymptomatic carriers of Salmonella. The most infamous of these people is Typhoid Mary, or Mary Mallon, who was thought to be responsible for a large number of infections and deaths in the US. She ended up having to be in quarantine for most of her life because she refused to give up her employment, which unfortunately was as a cook. So every time she found employment as a cook and moved from town to town, there was often deadly consequences. Different cerevars may be highly host-specific, so Salmonella typhi is only found in humans, and other cerevars may also be specific to other species. So, for example, there is a strain of Salmonella that only affects pigeons. However, other Salmonella may be adapted to many different types of hosts and can therefore infect across species. So on to the pathogenicity of Salmonella. Since the importance of Salmonella was recognised, there's been various initiatives to manage and control the disease. These include vaccines, antibiotics. One of the biggest impacts came from improvements in public health and also the introduction of industry measures to control the organism, particularly in raw foods such as poultry and eggs. Despite this, Salmonella is consistently one of the main causative agents of foodborne illness worldwide, and it's also more likely to occur in outbreaks rather than sporadic cases. This is due to the role of food in its dissemination, as we all have to eat food and drink water to live. The infectious dose of Salmonella was initially thought to be quite high, but it's now believed to be low. For example, less than 10 to 100 cells can be an infectious dose. This is especially in foods with a high fat content, such as chocolate and cheese, and also especially with children or more vulnerable people. In the UK, in 2006, there was an outbreak caused by a well-known chocolate manufacturer where they were aware that there was Salmonella in the product, but it was thought that the level was so low that it wouldn't cause disease. Unfortunately, it actually made at least 40 people ill, mostly children, and I believe it cost the company many millions of pounds in lost sales and poor publicity. So illness from Salmonella may range from mild symptoms of gastroenteritis to much more serious enteric fever, septicemia, severe dehydration, reactive arthritis, and in the most extreme cases, organ failure. And there are concerns about the growing resistance to antimicrobials for Salmonella. This problem is obviously not unique to Salmonella. It's been reported in the news quite a lot lately about the antibiotic resistance of many pathogens. So regarding prevalence of Salmonella, it's difficult to know exact numbers, as it's thought that for every reported case, there may be as many as 10 to 100 times more cases that go unreported if people just get a generally mild illness. However, worldwide estimates of non-typhoid Salmonella range from 200 million to 1.3 billion cases per year, and possibly 3 million deaths. Typhoid fever alone is estimated to cause 22 million cases and 217,000 deaths worldwide. Places mostly affected are Asia, followed by Africa and South America. And again, the people most affected are children, the elderly, and other vulnerable people such as the immunocompromised. So I've picked out a few notable outbreaks there. There are actually many, many to choose from. So I just cherry-picked a few examples to show the different foods and sources implicated. So they range from peanut butter to cucumbers to even pet hedgehogs. Who knew that people had hedgehogs as pets? And there's also been cases where Salmonella has come out from clinical teaching labs and infected people. The problem with some foods is that they get kept in food cupboards for a long time, such as tahini paste. People buy it and then don't use it for maybe 6 months to a year. So it can be difficult to get recalls on some of these problems, and that can then lead to outbreaks. In order to manage this, there are numerous alert systems around the world, and these are used to communicate possible contamination issues for Salmonella in various foodstuffs. These alert systems include the CDC, Centre for Disease Control and Prevention, as mentioned earlier, and also the EU Rapid Alert System for Food and Feeds. So due to the importance of Salmonella in food products, microbiological criteria for various foods have been established. Microbiological criteria defines the acceptability of a product based on the absence or presence or the quantity of the microorganism per quantity tested. This approach is widely used by the food industry, and by governments, alongside more preventative approaches such as HACCP or hazard analysis at critical control points. Microbiological criteria are established by considering a number of factors in each case. So these include the food type, the production process, typical storage and handling conditions, and also when and how the food is cooked, if at all. So in the table, I've tried to include examples that cover most of the main food categories, these being egg, dairy, fish, meat, vegetables and fruits, nuts and seeds, and ready meals. So you can see from this that generally the specifications for Salmonella require it to be absent in the quantity tested. The only exception to this is in the carcass of pig. In this case, where some units tested, they can contain Salmonella. So out of 50 tests, up to 5 can be positive for Salmonella. Presumably, this is because the risk is thought to be minimised by further treatment and by cooking. So due to the significance of Salmonella in foodborne illnesses, there's a vast amount of testing going on all over the world on a daily basis in laboratories to try and identify the presence of Salmonella and reduce the risks as far as possible. So fortunately, the majority of lab tests carried out on real food samples are negative, but this then limits the experience of lab staff to recognise Salmonella. Often the only time lab staff see a Salmonella is with the QC strains that they use daily in the laboratory, and these are usually nurtured to be in the best of health, so are not necessarily typical. Participation in PT therefore helps testing labs to validate their methods and to educate their staff. Taking part in PT also improves confidence for analysts and in the testing process itself, and it also provides a forum for participants to share their experiences and methods. PT samples can also provide a whole variety of challenging scenarios, including rarely encountered strains, a whole range of different inoculum levels and background flora, and also include stressed or atypical strains that are more likely to be misidentified in real samples. So I'm going to carry on a little longer in this next section, talking about how PT programs for Salmonella have evolved over the years, although PT schemes haven't quite been around as long as microorganisms. So the first proficiency tests were started in the 1940s, and this was in the field of clinical biochemistry. And the aim was to compare methods and compare results and then improve the quality of results between different laboratories. Food PT schemes came along a little later, so they were introduced in the early 1990s, following official recommendations such as the EEC directive mentioned. There is anecdotal evidence that this was driven due to 2 official labs both presenting data in a court case over food quality, and unfortunately the 2 official labs both presented conflicting data, which was a bit embarrassing at the time, so it was decided there needs to be some consistency in methods. In the early 1990s, LGC introduced their first food microbiology PT scheme called QMS, or the Quality in Microbiology scheme. And in its early days, this simply included one sample for Salmonella detection in skim milk powder, and it was for a large dairy customer who requested it at the time. In 1993, the International Harmonised Protocol for Proficiency Testing was published by Thomson & Wood, and this became adopted as a guide by many PT companies to guide them as to how to operate the PT schemes. And alongside this, in July 2002, a number of PT providers working alongside accreditation bodies, in the UK this was UCAS, became accredited to ISO Guide 43, which is now ISO 17043. So PT has since been adopted by laboratories worldwide to improve the quality of their test procedures and analytical data. The requirement to take part in external PT was incorporated into ISO 17025 in 2004. So the drivers for PT have very much always been food quality and safety, evolving alongside other initiatives such as standard procedures, the use of reference methods, materials, and internal quality controls, etc. And LGC has been on this journey from the very beginning, as will be shown on the next slide. So LGC, we're on the next slide. LGC has now over 30 years' experience in the production of PT samples, including Salmonellas, for Salmonella detection, enumeration, and identification. The whole range of current products will be covered later by Valerie. So doing a very quick count the other day, I estimated that LGC have sent out more than 2,000 different PT sample types for Salmonella over the past 30 years. And this is encompassing more than 200,000 individual samples. In 2009, LGCPT provided 54 sample types and over 7,000 individual samples for testing for Salmonella. In the 10 years since, this has risen to 128 different sample types and over 11,000 individual samples. So showing that even though testing has been around a long time, the demands for testing have increased even in the recent past. The typical number of participants on LGC schemes in any round can range from 40 to 400 plus participants, and the scheme is truly international with participants from over 160 different countries taking part. The number and the frequency of schemes means there will be a different Salmonella sample available every month. So if you miss one round, there's always another one coming along shortly. And the data from the schemes provides us with a wealth of information and data for analysis. Although this is generally qualitative only for Salmonella, as the test is generally presence or absence, so no Z scores required. So I thought I'd show an example of the contents that are typically included in LGC Salmonella samples. In this case, this shows sample contents for the QCS chocolate scheme over a period of about 4 years. You can see the levels range from anything to 5 CFU per gram to 100 CFU per gram. The percentage of satisfactory results ranges from 64% to 100% in a round. Most of the strains included in this period were typical with just the occasional atypical strain. So monitoring sample contents and results over time like this allows us to compare different situations, such as how does the inoculum level affect performance, how do different matrices affect the results, etc. It's also interesting to compare results when we send out a negative sample. We have to occasionally include a negative sample, as otherwise participants would simply be able to guess the results, as it would always be positive for Salmonella. So I know it's sometimes unfortunate for participants if they've only just joined a scheme and the first sample that they get happens to be a negative one. But it is an important test to make sure that you're not identifying false positives as well as false negatives. So a typical performance in a report looks like this. We have color-coded results, and the green results are satisfactory results and the red results are unsatisfactory. This report is from round MC286, which contains Salmonella Senegal at 14 CFUs per gram. The results for this round were 94% satisfactory, which is in line with what we would normally expect. The graph on the top right shows performance scores for each Salmonella round for a particular sample over a period of 5 years, and overall the average percentage of satisfactory results is 96%. As mentioned previously, this is the same whether or not Salmonella is included in the sample, so even if the sample is negative for Salmonella, around 4% of participants do report a false positive. So occasionally we do see results that are not quite as good and not so much green in the table. In this case, for round MC267 in July 2018, only 86% of participants reported the expected result. This was thought to be because the strain that we'd included in that sample was atypical, in that it does not always produce H2S and it's also lactose positive, and may therefore not form typical colonies on selective agar. So in this case, we carried out further investigations to make sure that it was the strain that had caused the problem. So we carry out a full technical investigation in such cases and review a number of factors. The first thing we do is review the strain characteristics. Every strain that we use in the PT samples for LGC, we perform a culture profile on it so we can see how the organism behaves under a range of conditions. For Salmonella, this includes looking at morphology on a range of agars and carrying out biochemical and serological tests. We also review the methods information in the report to see if any one method showed significantly different performance to others. Generally, this is not the case, as all participants should be using an appropriate method for the organism under test, and we don't tend to see any great bias with one method compared to another method. After reviewing the methods, we also look at other occasions that that particular strain had been included in PT samples to see if we could identify a trend. In this case, the organism had been included previously in a round, and we got very similar results from participants. So to continue the investigations, we go back and review our internal quality control results. Every single batch of samples that we produce, we carry out QC on it, and the sample should not be released for dispatch if it does not pass the initial homogeneity tests. However, in the case of an investigation, we do go back and check the paperwork, make sure that everything was correct, and we sometimes on occasions will do repeat tests on retained samples. In this case, even well after the round had closed, we still isolated Salmonella from 100% of the retained samples tested, so the problem wasn't one of stability. Participants on PT schemes often have questions about the stability of the samples during transport, so we also look at whether there was a relationship between the time taken for samples to be received and the result of the participants. We can also look at whether the distance travelled or the climate could have an effect. We do this by looking at whether laboratories in similar locations all return similar results. This exercise is quite time consuming, bearing in mind all the data that we have to go through, but hopefully we're making the process easier going forward by incorporating time of receipt into Portal, so it's something that should be more automatic in the future. Generally, time and distance are not found to significantly affect results. All microbiology samples are presented as lyophilized material, which is extremely stable and resistant to a number of environmental factors. It essentially puts the microorganisms into suspended animation until resuscitated by the participant. So in this example, after all the investigations, it was concluded that performance was definitely due to the presence of the atypical strain. So to summarize this section, proficiency testing is an extremely useful tool to be used as part of a comprehensive quality assurance program. PT allows comparison of your results with your peers. It also allows you to compare performance of methods and also performance over time by using trend analysis tools such as those in Portal. This can tell you if a problem is a one-off or has been developing over time. As mentioned, PT is educational due to the use of different strains, different levels, different matrices, and repeat samples are generally available for further testing if you want to investigate a particular result or sample. Technical support is always available through our offices and distributors, and taking part in an international PT schemes means you become part of a large global community. LGC PT can be a valuable source of information by looking on the website, taking part in participant surveys, and we also publish white papers and of course present webinars such as this one. And PT also has a lot of history, so hopefully there's a lot of data there that we can look at to learn about analytes and methods and how they've changed over time. Just one simple example of this is we looked at methods used for testing of Salmonella, and we went back as far as the electronic records allowed us to, and that was to 2009, and we compared that to 2021. And the most obvious change for me is that the number of people reporting using PCR has increased from 7% of participants in 2009 to 19% in 2021. And the reported use of the standard method had fallen from 43% to 22%. So clearly the methods that people are using are changing over time. And on that note, I will hand over to my colleague Valerie, who will be discussing the methods and the PT samples in much more detail. Thank you.
Thank you, Tracey, for this review of Salmonella in PT and for sharing your experience about AXIO schemes. So Tracey has described briefly how much methods have changed over the past years, and this is something that we are going to explore further. So it's interesting to look at the evolution of Salmonella methods used by participants over the time. You can see on the slide a report from 2007 and shows that the vast majority of participants use classical culture methods, typically selective and non-selective pre-enrichment, followed by streaking on a number of different agar plates. If we look at a more recent report on the right, this is a report from 2021, we can see that many different methods are used by the laboratories. So culture methods are still used by a good number of labs, but rapid methods such as ELISA, enzyme-linked immunosorbent assay, or alpha enzyme-linked fluorescent assay, but also chromogenic agars, PCR, or other nucleic acid-based methods are now widely used by laboratories everywhere in the world. So over the years, alternative methods have replaced traditional methods for the detection of Salmonella. bringing many different benefits. Chromogenic agars generally allow an easier identification of Salmonella. If we consider ELISA or PCR methods, they can be automatized, and this allows to test a large number of samples simultaneously and in little time. Also, one common benefit of most, if not all, the alternative methods is the quicker time to get a result, whether it's positive or negative, when we compare with the time it takes with traditional methods. So detection of Salmonella is often followed by the confirmation and or the identification of the isolated strains, and it's a requirement of the ISO to confirm the presumptive positive samples. This is also an area where tremendous progress have been made in the past years. Historical methods included serotyping, latex agglutination, biochemical identification galleries. More recently, pulse field gel electrophoresis of PFGE has been widely used for identification, but it's now more and more replaced by mass spectrometry. And even more recently, whole genome sequencing is gaining acceptance, and the WGS technology is increasingly replacing traditional techniques, providing faster and more precise answers. So 100 of different methods are validated by the AOAC, AFNOR, or Microval, which are the most common international validation bodies for the detection of Salmonella. AFNOR, Microval, or AOAC-RI are third-party certification bodies who assess the performances of the alternative methods. The performances that are evaluated vary between the different certifications, but they can include sensitivity, limit of detection, inclusivity and exclusivity, practicability, robustness, stability, and also batch-to-batch consistency. To date, there are over 100 methods validated, mostly for the detection of Salmonella, and a handful of methods that are validated for the identification or confirmation of Salmonella. So we know that the methods used by the participants are an important information in the PT report. And for this reason, we are aiming to capture more information in portal about the methods that are used by participants. But one of the challenges is that different labs will refer to the same method using different names. You can see an example showing different names for what is technically exactly the same method. So some labs will refer to the method with the commercial name, in this example, Vidas up Salmonella, some with the AOAC or the AFNOR validation number, and sometimes they will use a mix of both. So this is really adding to the difficulty to capture correctly the method information in PT. When it comes to choosing one or sometimes several Salmonella detection methods, it goes without saying that laboratories are really spoiled for choice. Fortunately, many documents can help laboratories to choose the most appropriate method for their lab. The technology, the number of tests to be carried out, the need or not for automation, the matrices to be tested, the importance of the time to result, etc. So there are so many criteria to consider when making a choice. And the technical instructions that are provided by the manufacturer can give really important indication on the technology and on the practicability of the method. But when it comes to know more about the performance of the methods, the validation reports, whether they come from AFNOR, Microval, or AOAC, will provide very valuable information. So the validation certificate that is provided by AFNOR gives some basic but important information, such as the reference method used, typically the ISO 6579 part 1, the scope of the validation, the restriction to scope, if any, and also warning if they exist. But labs can find a lot more information in the validation report and not only in the certificate. The report includes the data from all the tests performed during the validation. So the labs can get information from a third part about the accuracy study, the limit of detection for all the different categories of matrix that were tested, the results of the inclusivity and exclusivity studies, and also the practicability of the method and the results of the interlaboratory study. The validation certificate that is provided by AOAC for performance tested methods gives quite detailed information about the different matrices tested during the validation, so basically the scope of the validation. The reference method used for the validation, so for instance, the Bacteriological Analytical Manual, BAM, Chapter 5 for Salmo, the results on the inclusivity and exclusivity studies, and also a summary of the comparison between the alternative and the reference method. So choosing the right method is really crucial to get accurate routine results, but choosing the right PT sample to assess the quality of the testing is also very important. And this is the reason why we believe it's important to offer participants many different options so they can test relevant PT samples that reflect their everyday work. So AXIO now propose 16 different food matrices for the presence-absence of Salmonella in 25 grams. And we cover dairy, meat, egg, vegetable samples. Well, you can see all the different matrices on the list. We also offer a couple of pathogen packs, so Salmonella and the other major pathogen, Listeria mono and E. coli 157. And since a couple of years, we have also introduced some high weight samples, as it's now quite common that labs do some pooling of the samples before testing. So we propose the detection of Salmonella in 375 gram matrix in milk and also in cocoa. Salmonella is also, of course, a high concern in pet food. So this is addressed with our animal feed sample. We also provide a sample for carcass rinsate, and for lab testing Salmonella in primary production samples, we are introducing this year a new sample in chicken feces. Among the various serotypes of Salmonella that Tracey has described previously, Enteritidis and Typhimurium are very prevalent in the food chain, and they are in the worldwide top 5 serotypes responsible for human infections. So because Salmonella enteritidis and Typhimurium are specific concern for the egg and poultry industry, we are introducing 2 new samples for the specific detection of those serotypes in a chicken and in an egg matrix. Quickly, we also offer sample for the detection of Salmonella in the water, on surfaces, in the sludge matrix. We also have Salmonella samples for the cannabis industry and also for the pharmaceutical industry. As I mentioned earlier, confirmation of the presumptive positive is also an important step of the process of the detection of Salmonella. So we offer in our scheme Confident a panel of 3 strains for the confirmation under the identification of Salmonella. And we also have a specific sample for the serotyping of Salmonella. And last but not least, enumeration of Salmonella is of interest for certain industries, and we offer 1 sample for the enumeration of Salmonella in 10 grams. And I did not mention that we also have a couple of samples for the clinical laboratories. So we believe we offer a wide range of proficiency testing samples that cover most of the needs, but we know we can always improve our offer to better meet the needs of the participants. So we are always happy to consider the development of new samples for Salmonella, and we need to understand what market needs could be. So those needs or requirements can be in terms, for example, of new matrices. So we have added quite a few new matrices recently, but we are always happy to consider different ones. Also bearing in mind that getting a sufficient number of participants might become a challenge if we offer too many matrix options. Low-level contamination is something that we address in some samples. And it's important to keep in mind that a low-level sample in an open PT scheme is not likely to be at the limit of detection of the method. High portion samples, we may be considering new matrices that represent what labs test in routine. So we may also consider different weights of samples in the future. Enumeration of Salmonella could be something that we will explore further if there is a confirmed demand from some participants. Also, different serotypes. Tracey has shared some example of the variety of serotypes we use in our schemes, and we believe we propose the largest variety of strains for the detection of Salmonella. But there's always a possibility to add specific serotype if this is justified by technical reasons. And also there is a growing demand to use sequence strains in our proficiency testing samples. So sequence strains can make the tracking of the strains much easier, and this is really important if cross-contamination is suspected in a laboratory. So this is an ongoing project at AXIO, and we now have more than half of the Salmonella strains that we use in our samples that have been sequenced. In case you need a specific sample that is not currently available, I would recommend that you use our wishlist form on the AXIO website to share with us the details of what you are looking for. Thank you, and I'm now passing over to Brooke.
Thanks, Valerie. So I think there's been some really interesting stuff in there, and hopefully it's been valuable and informative for you. So before we move on to the questions part of the session, I'll just quickly talk you through how AXIO Proficiency Testing supports laboratories across the globe. So as we have talked about in this session, proficiency testing is a critical tool in ensuring laboratory performance is consistent and that measurements are accurate and reliable. Specified in ISO IEC 17025 as a key external quality assessment tool, PT can support any laboratory in Salmonella testing in a variety of different ways. It can not only help you to fulfill accreditation requirements, but to demonstrate competency to customers and regulatory bodies. By working with AXIO, you can compare your results with peers across the world, manage risk through early warning of potential problems, verify methods and instrumentation, as well as providing vital educational and training opportunities for your team. For 40 years, LGC has been leading the direction of proficiency testing, bringing our technical expertise and influence to drive the future of quality assurance. We design our schemes to meet your laboratory's future needs. It's what helps you consistently deliver a quality product, meet sector-specific standards, or achieve accreditation to ISO IEC 17025 or ISO 15189. Great results are born out of confidence, and by working with LGC AXIO Proficiency Testing, you can have the assurance that your decision-making is informed, reliable, and effective. So get involved today. You can view our entire proficiency testing sample and scheme offering through our website. That's www.lgcstandards.com/AXIO. Or if you have further questions or queries on a particular round or anything for that matter, please contact us at axio.pt@lgcgroup.com. Stay up to date with the most recent information by following us on Twitter or LinkedIn. LinkedIn especially, we regularly release free webinar opportunities, white papers you'll be able to download, new sample releases, resources, and much, much more. And you can find that at LGC AXIO on LinkedIn. So that's enough from me, so let's move on to the question and answers part of this session. Okay. Okay, so Tracey, we've been asked a question here. Is there an ideal frequency to participate in a PT for a given year? Tracey, you might be on mute.
Hello. Yeah, I'd muted to kill the background noise. No, I don't think there are any actual regulations or specifications to say how often you should take part in a proficiency testing scheme. I think it's very much based on your own laboratory. So if you want to look at how many samples you routinely test for Salmonella, how many tests you're producing a day, how many different analysts you have, you can then decide how appropriate it feels to your laboratory to take part. There are arguments that some people are very much for high frequency, so take part every month if there is a scheme available. Other thoughts are maybe take part once a year, or maybe when methods change or when analysts change. But I think it's very much up to your own laboratory to have a look at your circumstances and decide how frequent you want to take part.
Thank you, Tracey. One for Valerie now. What about tahini as a matrix, since Salmonella in it is starting to be a global problem?
Tahini, I'm not sure I understood right the matrix. You said tahini?
Tahini, T-A-H-I-N-E.
Yeah. Well,
shall I answer this one?
Yeah, well, we just to mention, we have introduced in sesame seeds,
yep.
Which is quite close to tahini because sesame seed has been referenced as a major issue for Salmonella a couple of years ago, and this is the root of the introduction of the sesame seed matrix.
Thank you, Valerie. Okay, so we've had another question. Is it possible to receive sequence data from LGC if the lab wants to check if they have had a cross-contamination issue? Tracey?
Yes, this is something that we've been doing very recently. So we have started to sequence all of our Salmonella strains, and I think we probably have about 50% of them sequenced at the moment, as Valerie said. So the intention is we will hopefully be setting up some kind of storage facility so people can go on and access that and find out what the sequences of different organisms are. Obviously, this would be available for all Salmonella, so it wouldn't necessarily be sent out scheme by scheme so you'd know what was in the samples. But we are hoping to have this information available. And also, if you want to contact us at any time, if you have a concern that there may have been cross-contamination from a PT sample, we will give you as much information as possible about that strain.
Okay, great. Thank you, Tracey. Okay, so we've had a question about the spice matrix. So does your spice matrix include inhibitory substances such as onion, garlic, cinnamon, etc., i.e. as well as low pH? So does your spice matrix include inhibitory substances such as onion, garlic, cinnamon?
We don't tend to use any of those as our herbs and spices, so we just buy commercially available herbs and spices, but we tend to use sort of pepper and parsley, ones that we know we have validated. So no, at the moment we don't use anything that has any specific inhibitory properties in there. I think what we try and do is go down, as Valerie said, if we introduce too many matrices, we then have the problem that there are not enough participants interested in that very specific matrix. So we try and go down the generic route as much as possible, whilst also offering a good range to participants. So if that was something that enough people expressed an interest in, then it is something that we could look at developing.
Great, thank you, Tracey. We've had another question. Have you been involved in many investigations of cross-contamination from a PT sample?
I can say we probably have, but I can count them on the fingers of one hand over the years I've been working in proficiency testing. So it's quite a rare occurrence. I think sometimes we get people asking us what the organism was because they feel there may have been cross-contamination, but in many cases it is not the PT sample. But I believe there have been a handful of cases where there has been cross-contamination. And in those cases, we've always worked with the participant concerned and helped as much as possible.
Okay, and that kind of follows on to another question we've had. So I would like to know, are the different food matrices artificially contaminated or not? And how do you avoid cross-contamination when you manipulate the PT items?
Yeah, so what we do is we start with a sterile matrix so that we know that there's nothing else in there. It's very, very difficult to go and buy a food product off the shelf that will have been naturally contaminated. So we do artificially contaminate all our matrices. And this is done under aseptic techniques. We prepare one sample at a time. We test everything in between, throughout the process, after the process, before the process, to make sure there's no cross-contamination when we're making samples. When we're preparing a Salmonella sample, for example, we would prepare just that sample on that day in the one room to avoid any chances of cross-contamination. And as I said during the presentation, every single batch of samples that we make go through quality control testing after they've been produced, after they've been weighed out, but before they get sent to dispatch.
Thank you, Tracey. And we've had a question asking, any chance in the future we would look to do genetically marked PT strains with unique features? For example, UV fluo in the future?
Yeah, as Valerie said, if you want to put something on the wish list, if we feel there is enough interest in some of these proficiency tests, then it's certainly something that we can look at developing. I think with some of these tests, they're very new and it's also quite specific. So there's only maybe a small number of laboratories interested at this stage, but it's certainly something that we can look at if there was an interest there.
Great, thank you, Tracey. Okay, we've had a question from somebody asking, why is enumeration of SLM of interest? So that might be to do with us.
It's been well, not a requirement because it's not I mean from a regulatory perspective it's present absence, but we have seen some industries having interest in the enumeration of Salmonella. I think this is something that is ongoing, especially in the US right now. It seems that there is more and more demand for enumeration of Salmonella. I would say, especially in the meat industry. I would need to confirm that, yeah. Even if clearly the regulation goes with absence in 25 grams, we see some interest for enumeration of Salmonella occasionally. And we have a decent number of participants on our enumeration sample, which has been, I mean, Tracey can say that better, but which has been there for several years, I think.
Yes, I mean, this is one that we introduced because of customer requests, and we ourselves were quite dubious as whether this was something that people would be interested in, but it has been on our scheme for many years and we have quite a few people that take part in the enumeration test.
Great, thank you. I think we've got time for a couple more. So we've been asked, do you actively seek out atypical strains?
So the answer to that is no. All the strains we've recently added to our culture collection are not atypical. I think some of them we've just had historically, but when UCAS come and accredit us, they agree that it is important that we occasionally use atypical strains, because whenever there's been a sort of situation or an outbreak and there's been difficulties in identifying the organism, it's usually because it's atypical and doesn't quite behave as people are expecting. So I know it sometimes frustrates participants, but I think there is definitely an educational side to it. And as you saw from the example, we only include atypical strains very infrequently.
Yeah, and I would add to that what was called atypical strains, I would say years ago, and what was atypical strains for the labs who are using traditional method, and could be a challenge for the labs using culture methods, is very unlikely to be a challenge for labs using PCR, for instance. So it's I mean, it's moving the border of what is an atypical or challenging strain, really.
Okay, great. And I think we've got time for one more question. So following on from the enumeration sample question, we've been asked, what enumeration method would you recommend?
The methods that participants tend to use there is simply doing a spread plate count on XLD. So that seems to be the method that people are using. I mean, the methods that are reported in the report should be shown in the table on the report. So if you can have a look at that and see what other methods people report over time.
Thank you. So that's pretty much all we've got time for today. There have been lots of questions come through. So what we will do is we'll take them away and we will reply to you individually, just to make sure that they get answered. So as we finish, I want to thank Tracey and Valerie for presenting today's session. Hopefully you have found it informative and interesting. Like we said before, if you want further information on our AXIO offering, please visit www.lgcstandards.com AXIO. With that, I'm going to finish this session. Hope you have a wonderful day and thank you for your time. We'll speak to you all soon. Bye.